the Department of Cardiology, University Hospital of Copenhagen in Denmark. And her title is Resuscitating Octogenarians with Out-of-Hospital Cardiac Arrest. Please, Dr. Soeholm.
Thank you and good morning. Thank you for the invitation. It's a great pleasure to be here. My talk is about resuscitating octogenarians, which is the 80-year-olds, the old people, with cardiac arrest and whether it is worth resuscitating these patients. I have nothing to declare. So what does a cardiac arrest in an 80-year-old lead to? That's the question. Does it lead to death, or are the old people after the incident able to do what they did before? That's what I'm going to talk about. About 60 out of 100,000 patients suffer from a cardiac arrest each year, and that is worldwide. And only 1 out of 10 survive the incident, so it's a very serious condition. And as we've just heard and from other studies, we know that both comorbidity and frailty increase with age. And therefore, we have ethical dilemmas when the very old patients suffer from a critical illness, such as a cardiac arrest. And as physicians, we swear the Hippocratic Oath to do no harm. And as you may agree, all people have the right to have a peaceful death without having to be drawn through ICU treatment and all that. So it's very difficult whether to treat these patients or not. So in this study, we looked at the survival and the functional status after the cardiac arrest in the 80-year-olds. And we looked at 4,000 cardiac arrest patients during 9 years in the Copenhagen area in Denmark. And what we found was a quarter of those, 25% of the patients, were actually above 80 years old. So that was quite surprising, that was so many. And looking at cardiac arrest research, there's 2 points that you need to survive. When you suffer from the cardiac arrest outside the hospital, you have to survive the resuscitation attempt and be brought to the hospital alive. And looking at those, we found that 25% of those were successfully resuscitated and brought to the hospital of the 80 years old. And that was compared to 40% of the younger patients below 80 years. So there was a difference here, but was not completely fertile. And looking at the patients that were successfully resuscitated, those are the patients shown here. How many of these patients are discharged alive? And we found that 21% of the octogenarians, the 80-year-olds, were discharged alive compared to 44% of the younger patients. And one thing is mortality, and another very important thing, especially in the old people, is the functional status. How are these people able to carry out their daily activities after the incident? And what we found was that the red people shown here were not able to carry out daily activities, but as you can see, the majority were actually able to carry out daily activities. They were discharged with a high functional status. And in the 80-year-olds, it was 75% of the patients, of the discharged patients, compared to 85% of the younger patients. So there was a difference, but the majority were discharged with a high functional status. So in conclusion, we found that survival after a cardiac arrest was lower in the octogenarians, the 80-year-olds, compared to the younger patients. However, the majority of the 80-year-olds survivors were discharged with a high functional status and were able to carry out daily activities independently. So the conclusion is that refraining from resuscitating the old people, the 80-year-olds, does not in general seem justified. Thank you.
Thank you so much, also for keeping the time so nicely. Are there any questions from the journalists, from the audience? It was first there. And please, please we have been instructed to ask for a presentation of the questioner. So please state the journal or where you're from.
I'm Ed Sussman with MedPage Today. What was the range? Did you look at the range of age of people who were resuscitated and were able to go home with high function? You You say 80 plus, how old were some of the older individuals who survived an out-of-hospital resuscitation and still was able to function well at discharge?
It's a very good question. And we looked at also the 90-year-olds and octogenarians, and very few of those were discharged alive with a high functional status. It was just a few of those.
So most of these people...
Mostly in the 80s.
Mostly in the... Did you have any outliers that surprised everyone?
We had a few, I think it was 93 and 95, actually.
There's a question over there.
Peter
Please.
Henning, thrombosis and hemostasis. Did your results maybe suggest that the functional survival status is not due just to age in terms of years, but rather it's considered to be elderly fit versus not elderly fit patients?
That's a very relevant question as well. We don't have any measures for the relevant fit. We have, I didn't show you those results, but we have data on comorbidity. And we could see that the 80-year-olds have a higher degree of comorbidity. Very few of those had no comorbidity at all. And it was also associated with outcome, the comorbidity. But frailty was not measured in this study. But it's very relevant.
Yes, please, questions there.
How was the mental status of these people leaving the hospital, going home?
The mental status was measured in the previous, I'm just going to back up here. And as the white men in the bottom, not the red, but the white, were discharged with a high functional status. And that's being able to carry out your daily activities independently, so without help. And this is at discharge, and we know from other studies that if you measure this again, maybe a month, maybe 3 months later, people tend to get better. So this may even be better after some time. But we don't have those data.
Melissa Walton Shirley with the Heart.org. Do you have any data about the incidence of rib fractures, sternal fractures, and issues with CPR that occur in the patient's advanced age?
Yeah, that could be very interesting, actually. We don't have those data, no. Yeah.
This is a registry study, I suppose.
It's registry, yeah.
Well,
It's both a registry and we went through the patient charts. So, yeah, we didn't talk to them. No.
By curiosity, are you going to interview those?
It is from 2002 to 2011, these incidents occurred. So maybe we are doing that in a prospective study that we're just planning. But we haven't done it on these patients.
yeah, sure. We have time for that.
John Mandrola from the Heart.org. How long after discharge did you look at these patients? So, yes, they had good functional status, but for how long? Do you have that data?
No. We only have data at hospital discharge, from the day they were discharged, because we have the data from the chart, the hospital discharge chart. So if you're going to have those data, as Eva mentioned, you need to call them and talk to them. And this is retrospective, it's back to 2002, so I guess a few of these patients have passed away. Maybe not due to the cardiac arrest, but due to age.
So, is another question over here?
Ed Sussman with MedPage Today again. Could you describe what you consider high functioning? What it was is this the ability to do activities of daily living? How do you characterize high functioning?
We use a score which is called the Cerebral Performance Category Score, which is validated and internationally used. And it's a score of 1 or 2 on those. And that is that you're able to do everything, or you're able to do everything but have a little neurological, what's it called? Yeah, the functional status may not be as it was before, just a little bit lower, but you're still able to do your daily activities without help.
So basically being independent.
Yeah, correct.
So, to sum up this, I think that you have about 250 persons above 80. And among those, I figured out that about 15% of them, down to 37, 38 persons, really came out of it in good health. So I mean, it's down to about 15% of the initial ones.
Yeah.
Of course, for them, this is so important. But it's not more than 15%.
No,
No.
that's correct.
Yeah. Thank you very much. I think we move on then.